More than 5.2 million coronavirus cases were confirmed around the world last week. That is a new record, according to the World Health Organization. Experts say India's second wave is a driving factor in the recent rise in global cases. The nation's total case count is now above 15.3 million. That makes India the second worst hit country in the world. Here in the U.S., top officials are combating vaccine hesitancy as variants cause alarm. Dr. Anthony Fauci is urging Americans to look at the data, adding, quote, "The highway to normalcy is vaccination." For more, let's bring in Dr. Payal Patel. She's an infectious disease physician at the University of Michigan's Medical School. Dr. Patel, welcome. Thank you very much for being with us. The CDC is predicting fewer cases, hospitalizations, and deaths in the coming month, but also says 13 states have a greater than 75% chance of seeing an increase in deaths in the next 2 weeks. Which states are of most concern at this point, and why is that?
You know, we're having a lot of cases here in Michigan. It's really leading the states that are of concern right now. Other states include Florida, Rhode Island. But really, I would consider yourself still at risk if you're in any state and are still unvaccinated. Those are the populations in each state that are really making up the majority of cases that are coming into the hospital and getting really, really sick.
Well, Dr. Fauci says that the highway to normalcy is vaccination. More than 86 million people are fully vaccinated. How long is this road ahead, Doctor?
You know, it's really up to us. It's up to how many people will get vaccinated and how quickly that rollout can happen. I think that the researchers who came up with these absolutely very effective vaccines worked their tail off to give us multiple choices. The rollout has been going with some, hiccups, has been going pretty well. And now we're at a point where we need to talk to our friends, our family, our neighbors, ask them, what is it that's stopping you perhaps from getting the vaccine? I think the quicker that we can get more people to get the vaccine, we would be able to come out of what we're in right now, which is seeing the variants of COVID really spread like wildfire in those that have not been vaccinated.
And Doctor, I want to ask you about something that we've been hearing about, that there have been a number of reports from women who say the coronavirus vaccine altered their menstrual cycles. What more can you tell us? Is that a cause for concern?
You know, researchers are looking into this now. It's important to remember that multiple things can really affect someone's menstrual cycle: stress, immune system, and knowing that the vaccine can affect your immune system, it is possible. But remembering that before we can make any conclusions about that, it's best to let scientists and researchers really try and figure that out. So if you're able to get involved with a trial that could be looking at that, that's a good way to figure it out. There is no research right now that shows that it would permanently affect your cycle. And remembering that if you were stressed out about getting the shot, it could have just been the stress itself.
Well, I want to also talk about India's second wave. The country is averaging about 220,000 new infections per day. That is the fastest rate of infection in the world. Thousands are dying daily. What seems to be happening in India?
Yeah, it's really unfortunate. You know, when India went into lockdown, they had a pretty effective lockdown. Lots of people were not out. They did not have the vaccine rolled out yet. And so now what we're seeing is so many people are still unvaccinated, yet there have been lots of unmasked get-togethers, whether it's for religious or political reasons. And that is unfortunately leading to the opposite of social distancing in a country where so many people are still at risk for getting bad COVID-19. So really in India, getting that vaccine out and sticking to the public health measures would be the way out of this. But things are very, very bad there.
All right, Dr. Payal Patel. Dr. Patel, thank you very much. It sounds like you have a little one there, so we appreciate you taking the time to talk to us today. Thanks, Doctor.
Thank you.